All right, good afternoon, Commissioner, Attorney Moore. I know Counselor Edwards is joining us momentarily, and we may have some other folks jump on, but I do know the Commissioner has another engagement as well, so I want to get started promptly at this time, 4:30. So this is the biweekly COVID-19 Response Committee meeting. We are joined by Commissioner Carlton Harris, as well as by the new Director of Recovery and Continuity, Attorney Tom Moore. I know Counselor Justin Hurst just joined us as well. And so we will begin the meeting today with a report by Commissioner Carlton Harris. And Commissioner, I'll hand it over to you. Oh, Commissioner, I believe you are muted. And while you unmute, it looks like we've just been joined by Counselor Edwards as well. So thank you, Counselor Edwards.
So I've started out by saying thank you, Counselor Letterman, for speaking with me this afternoon. I think many of the things that you asked me, those questions are questions that perhaps other counselors have. So I'm not going to spend a lot of time going over the data. I think it's very clear that we added 95 cases this week as opposed to last week. We continue to see the rise in COVID cases amongst our under 30 population, and under 50 accounts for 86% of our cases, and last week it was 88% of our cases. So we recognize that it is really a youth are fueling this current surge. So this time last month, all of last month, we had 344 cases. Right now we were at 653 cases. So in the middle of the month, we are 309 cases above where we were all of last month. So clearly, I think you all know by listening and doing the research across the country that there is a surge happening. I think because of our low vaccination rates, it's more pervasive in our community. There are many vaccination clinics going on. There really isn't any barrier to anyone getting a vaccination or getting tested. Those are readily available, and we certainly can refer people. We know that 50% of Springfield residents have received one dose. 44% around there, a little more, are fully vaccinated. And so my report, my graphs are up on the city's website, as you know. I think the other thing is that we will stand up a COVID-19 Youth Council. That council, those young people will act independently, but they will have individuals who will be facilitators for them. And so we are bringing closure to that at this point. And I think hopefully within the next week or so, we'll be able to make an announcement. We will have 10 to 15 young folks on that task force or that council. And be clear, we will not guide their direction. They will guide themselves. The goal is to give them the framework to be able to operate in, and then have them operationalize the messages that they want to get out, the outreach that they want to get out, the venues that they want to go to, the community-based organizations they want to work with. So it will be that team of young people who will make those decisions. So I will stop there, and I will answer any questions that that anyone might have.
Thank you, Commissioner. Counselor Edwards or Counselor Hurst, if you have a question for the Commissioner, please feel free to just raise your hand in the queue. The Commissioner and I did speak a little earlier today on a couple of points as she referenced. And so I think one of those points, Commissioner, that might be helpful for other counselors to hear about as well is how we plan to handle potential booster shots in the future, both for the general public and those that might be immunocompromised. Would you like to elaborate on that?
Sure. Those who are not immune compromised will receive their immunizations, their boosters, in the same way that we administered the initial 2 or 1 doses. The CDC, I have not been on television today. I know that the CDC, and I have not been able to read any documents. I know the CDC was going to put out a advisory that says that everyone, particularly those who were vaccinated in January and February, and as far back as December, some folks are vaccinated, if you remember, they could potentially need boosters in September. So we certainly will gear up for that. As far as immune compromised individuals are concerned, we will be asking them to check with their primary care physicians in order to get a booster shot. We can administer it, but my concern is that individuals who have had chemotherapy, individuals who have had organ transplants, I think that it's going to be important for us to really understand that they are in fact eligible to get boosters immediately. So we are going to advise individuals to start with their primary care physician. And I know that throughout COVID, all of them have been in touch with their primary care physician. So that is how we'll handle it right now. We're happy to give the immunization or the vaccine, but I still would want to make sure that a primary care physician concurs with us doing the booster.
Thank you, Commissioner. And the other thing that we had discussed was the contact tracing efforts relative to the new cases. Could you elaborate a little bit about what that's telling us, if anything, relative to the sources of cases as we are currently seeing them?
We have not, if you remember, a cluster is 2 or more cases. And certainly there are clusters within household, but our contact tracing is not going back to anything that we can trace back to a very large gathering of those individuals. Now, if someone went to the Harambee, and I did say to you last week, 35% of our cases were from the African American community, 35% were white, and the balance was other and unknown. And our data reporting, Hispanic or Latinx comes out as unknown or other. And so, but pointing out that a large number of those cases last week were, from the African American and white communities. We do not ask the question, and I appreciate the question from you, Councilor Letterman, and perhaps we should. Did you go to the Harambee? Did you? So, we do the contact tracing around sustained 15 minutes and less than 6 feet apart, and those are the contacts we get. So that's where we are right now. Contact tracing, my staff is going to be extremely challenged because not only are we going to have to vaccinate, because the state shuttered most of their CTC staff, it means that our staff is going to have to gear up to do contact tracing, isolation, and quarantine. At the beginning of the pandemic, it was only boards of health that could vaccinate. We have many more vaccinators now. And so, but we do not have entities who are licensed to contact trace. That becomes us and the CTC. So we will be still standing up our vaccination clinics. However, contact tracing, isolation, and quarantine now move again to the forefront of the work that we have to do internally.
Thank you, Commissioner. And just to be clear, I think you were just using the Harambee as an example.
As an example, absolutely.
In general, spoken about many large events. I think it would be a good idea as we ramp that contact tracing back up to ask that question, so we can have an understanding of it. But it sounds like right now the data is showing that folks are just being exposed in general, and they could have happened anywhere at this point. So that's helpful. I'll speak with the legislative delegation about the state's contact tracing efforts, and then hopefully planning to stand those further up, especially as I'm sure other communities like Springfield are in the same place. So those are my questions for today, at least. Councilor Hurst, Councilor Edwards, did you have any questions for the commissioner?
No, just appreciation for the hard work of her and her staff.
Thank you, Councilor Edwards. I appreciate you as well.
Commissioner, just a quick question, and thank you, Mr. Chair. Mask wearing. We're having these large events. Pancake breakfast is happening this Saturday, and I'm sure there are a number of events happening over the course of the next month or so. At what point do we say we're just going to require mass at those events, especially if they're, either on city property or sponsored by us, because we know, relying on folks, through the honor system, I have to imagine that it's just not working the way in which we would want it to work.
Councilor Hurst, thank you for that question. I have always articulated my concern about these events that are going on, particularly since our cases have been rising. To mandate face coverings outside is not what, as you know, the CDC is recommending. When do we get to a place where we say that these gatherings have to have face coverings? I don't think that we are there yet. Based on our numbers are going up, but the question that we have to ask is, are numbers going up because of outdoor exposure, which we know is less than indoor exposure? I'm really more concerned about when we all go back inside. I think we can mitigate the outside spread right now, but to your question, I do not think the pancake breakfast is this weekend, and we are sticking with the CDC's recommendation. Stone Soul, we're sticking with the CDC's recommendation. That's it for outdoor celebrations, my understanding. I think once we get by those two, we'll be able to make some different decisions around face coverings moving forward. I'm hearing from venues, indoor venues that have been scheduled for indoor celebrations. They're now contacting and saying, should we go forward? And my advice to all of us is, let's give it one more week. Let's look at those numbers carefully, and then let's make decisions based on what we're seeing over this next week. I will say to you, today's numbers were decent. They're 26. Now, if you remember, the 104, I believe, was Friday. And so today to have 106, I never thought I'd celebrate. I mean, to have 26, I never thought I'd celebrate that. But I do think we need to watch those numbers very carefully.
Thank you, Commissioner. Thank you, Mr. Chair. That's all I have.
Thank you, Councilor Hurst. Commissioner, thank you again for joining us, and congratulations on your pension award. It is well deserved, and we'll look forward to celebrating you at that event.
Thank you very much. I appreciate all of your work as far as COVID is concerned. And I just want us to remember this is a marathon and not a sprint. We're going to be working on this for quite some time. And I think we have to get used to a world where COVID is a part of our lives. And I think that we are in the place where we may need to mandate vaccines for city employees. But I should say to you, our numbers in the city for employees are extremely low right now. So I'm not seeing a surge there at this point. But if that changes, then we're going to have to change our policy. And to Councilor Hurst's point, if that changes as far as outdoor venues are concerned, then we're going to have to think about that as well. But I very much appreciate all of your support. So thank you.
Thank you, Commissioner. We will move now to Attorney Tom Moore, who we are all familiar with. As folks know, Attorney Moore has received a new position just recently as the Director of Recovery and Business Continuity relative to the pandemic recovery. So I thought it was appropriate for Attorney Moore to join us today and just talk a little bit about his new role and what he sees as his goals going forward, as well as how we can support him from the City Council side. So Attorney Moore, welcome, and thanks for joining us.
Much appreciated. Thank you, Councilor. Yeah, I think the department was created with the idea that this is a unique opportunity. We wanted to have a very focused approach on how to, take the money in, evaluate the public input, and then disperse the money appropriately. As you councilors are probably very aware, there's a lot of different buckets that go into the ARPA funds that were accepted. And some of those buckets are a little more straightforward than others. So right now, I think it's the phase one of the process, excuse me, which is gathering some information. It's important that we take in as much data as we can for each one of these categories. A lot of that's going to be done through soliciting public input. The mayor's office and the council has both very rightly trumpeted the idea of going into the public and really hearing from different groups in every neighborhood, in the city, to try to get a good, total understanding of where the need is for some of these funds. And I think at that point, once we get through data collection, we're going to be going into what I would think of as like application phase. We'll have a series of RFPs, and you've heard references to those, that'll go out to the public in different categories. So small businesses or nonprofits, they'll have their own, proposals to submit through their own RFPs, as opposed to somebody looking for maybe a household type benefit from the program. So, once those RFPs come in, as you might imagine, we'll be doing the selection and evaluation, part of it. And then, the awards phase will go out where people get the money dispersed. And then we'll be dealing with monitoring, the different groups that are going to be receiving the money, and doing our best to report as accurately as possible according to the Treasury guidelines. So kind of with that process in mind, that's really what the department, I think, is created for. I look at it as like a sort of like a 5-year assignment here, where, the money is set to be obligated by the 2024, excuse me. It has to be fully expended by 26. So by the time we get to, this time in 2026, we'll be pretty much having spent all the money, and we'll be dealing with reporting and kind of compliance with whatever auditing actions I'm sure the federal government will take. So that's kind of the overall scope of things. I'd be happy to answer whatever limited or questions, whatever limited information I have at the moment. Like I said, I'm very much in the setup phase, trying to staff up the office with some budget analysts and project monitoring positions, and trying to get a framework for the RFP process in general, and how long will take to get public input. It's a question of wanting to get as much input as possible, but not wanting to wait too long to get things out on the street, because people really do need help, and that's really what we're for.
Thank you so much, Tom, for those initial thoughts, and I think we all share those goals and share that concern. Have we gotten any more guidance relative to exact expenditure guidelines? I know for the last several months it's been a little bit vague, which I think has made it a little more challenging for some folks to maybe envision exactly what spending could occur. Have we seen any update on that? And if not, when do we expect to?
Yeah, the interim final rule, I think it was issued July 16th, and that was like the last formal declaration of guidance that came from the Treasury Department. They did issue some updated frequently asked question responses that were very helpful, and I think those came in early August or near the end of July. And recently, the guidance I've seen has been around the reporting, kind of giving information about how communities are going to comply with what the reporting requirements are. So some of the stuff I've seen from the last week or so has been about, the porthole for, reporting and signing up for giving the interim report, which is due August 31st. So that initial report is sort of the baseline that every single recipient will have to give unless they're in a certain category of city or town. We fall into the category of having to give the report like most other communities. So that'll be my first, focus beyond data gathering. We'll be getting this report kind of together and in compliance with the Treasury's rules. So I'm kind of boning up on that stuff and getting more educated on that, the technical aspects of that portal.
Thank you. We're joined also by Councilor Mala Brown. Councilor Brown, thanks for joining us. We're have moved on to Attorney Tom Moore's presentation. Tom, who are you reporting to in the new role?
Sure. It's under the CAFO. So I'll be reporting to TJ and the finance department, I believe, is the umbrella that this department falls under. So that'll be my primary reporting be to the CAFO, and it'll be, in addition to reporting to the mayor and reporting to the council through its committees, there's going to be a number of people I'll be kind of, giving information to and responding to. But yeah, my day-to-day reporting would go to the.
That makes sense. You'll certainly be busy, as I'm sure you're already finding. Are there any questions for Tom, Councilor Brown, Councilor Hurst, or Councilor Edwards?
I have a question, but I just needed some communication regarding your past work related to a business on Boston Road that may have to do with potential litigation. So if you could give me a call or
Sure.
something.
On that matter, we can, let me give you a call, do it first thing in the morning. We could talk. Are you around in the morning, Council?
That'd be great. Great.
Right.
All right.
Yeah, I'll put it in my calendar now. We can talk. No worries.
Okay. Thank you.
Excellent.
And congratulations on your new position. I think Jesse touched on it. I was wondering if you were cabinet level, you're your cabinet, what do you
I
call
don't
it?
think so. Yeah, I don't think so. It's a new department. I haven't, I believe it's under the Capitol's umbrella. I haven't been informed that any of that stuff. To be totally frank about it, I've been so caught up in trying to get educated on this stuff and not feeling very satisfied with the guidance we've gotten so far that I haven't had too much time to go into where within the system it fits, the department itself. I know at certain points somebody will show me like the hierarchy of the map of where it goes, but I'm guessing if you look at finance, it's like a big umbrella. It's somewhere under there.
So should we be reaching out to you with our ideals on how the money should be appropriated? Or should we go through the traditional
I think
channel?
it's certainly appropriate on this subject to send things to me. That's appropriate. And of course it's always, fine to copy TJ on those as the ultimate kind of director of the department.
Okay, well, welcome to your new position, and we will miss in your old capacity. You were very, I can't speak for everybody, but I had much respect for the work, and I always trusted your judgments and how you handle things. So I guess this is a promotion, so I'm sadly happy for you.
Well, it's much appreciated. Thank you for those words, Council.
Thank you, Councilor Edwards. Councilor Hurst, did you have anything for Tom? Yeah, Councilor Hurst, go ahead.
I did. Is this all you're doing, Tom? I mean, are you still doing work in the law department?
Yeah, it's a good question, Councilor. It's a semi-complicated answer. As you know, I'm in the process of wrapping up my law department assignments to focus on this office, essentially. So there are things that I can't do immediately. You know what I mean? Some of the litigation matters are just sort of, their tentacles are out there. Those will resolve themselves. The solicitor has been great about, giving me whatever support I need on those cases. And I should be fine balancing that stuff. The last 2 weeks have been very hectic just because my vacation timed up a little strange with this new appointment. And it was, as everybody I'm sure knows, you get back into the office and I had a ton of assignments already to deal with. And then trying to start a new office is a lot of running around as well. So I foresee eventually within the very short term, I will be 95% focused on this office with 5% probably left within the law department assignment.
Got it. Thank you, sir. We wish you well.
Thank you. Thank you, Councilor.
Thank you, Councilor Hurst. Attorney Moore, I think it sounds like we have a good idea of what you're planning on doing in the months ahead. So, I'd leave you with just my thoughts on how, how you feel that we can continue to support you as you undertake the new role.
Sure. I think this committee, Councilor Whitfield's committee, are both approaching it with the right approach. This is a team effort where we're all kind of going to walk, hopefully hand in hand, down this road of helping everybody out. And that's the way I'm looking at it. I don't know, I don't know how it works otherwise. There's going to be a lot of different interests that are going to ask for a lot of different things, and many of them will be eligible to be getting assistance. So it's going to be a lot of effort for all of us to be responsive to those needs. So it's not going to be it wouldn't be able to be just me. I certainly would not want that at any level. I want to have this kind of a consensus as best as I can get from everyone about where we're going with this money. And then that way, when the money gets spent, everybody feels like they bought in and they have something they can kind of look towards and say, well, I did that, or I was part of that. And it's going to be a lot of people. So it'll be this committee for sure. Councilor, your COVID committee is at the top of that list for sure. And, Councilor Whitfield at the finance committees right there too. So there'll be two committees where I'll be reporting regularly. I also foresee at a certain point when the office is fully up and running and I have a designated space at City Hall. At the moment, you see me, I'm in my kind of paper closet here at Tapley Street where I still have a bunch of my files. So eventually I'll have an office at City Hall that'll be set up for this, I believe. And you know, I kind of plan on giving some briefings on a regular basis once everything's up and running, because people are going to have a lot of questions, and I'm hoping to be able to respond to those as quickly as I can. And that's kind of the objective of the office, be able to give public information out. And of course, once that information gets out to the councilors, you would likely have some questions, and then I can come and appear and give information, and you'll have some data from me already in advance. And it'll hopefully be this very cyclical operation where we, you know, I get you the information way ahead of time. You have the questions, I can come and answer them, and then we keep going, doing that back and forth.
That's great. Well, I hope you'll view, you know, the council as a resource for you. You know, please don't hesitate to reach any of us directly. And I think you're well positioned, having, you know, worked with the council specifically as our attorney and with the administration. I think, you know, this is a good role, in my opinion, for you, because you already have those relationships. And as far as, you know, this committee, so this committee has been meeting bi-weekly, and then certainly as needed. In addition to that, I know that the Finance Committee Chair, Councilor Whitfield, is also holding a weekly meeting focused specifically on the funding from ARPA, which is fantastic and much needed. So as to not, you know, monopolize your time, as I said during the last meeting, I think probably what would be appropriate is, you know, you and I can just stay in communication. And if there's a particular, you know, item of interest that's coming up in the COVID committee, kind of more so related to the COVID-19 response side of things, then, you know, we would love to be able to know that we can count on you to come on. But certainly in beyond that, I think it makes sense to continue to have those conversations in finance. And that way we're not spending, you know, having all your time in city council meetings every week.
No, I very much appreciate that, Councilor. It goes a long way. I much appreciate it. And I should say too, with regard to the city council's assistance and further role within the process, you know, there are going to be evaluation committees, as I mentioned before, I think in Councilor Whitfield's committee, about the RFP process will come to a certain point where, you know, we'll be needing to make evaluations based on the criteria we set up. And there'll be panels set up for all those decision makings. And, you know, the council is going to have a seat at each one of those. And it'll be sort of, I think, up to the council to figure out how they want to organize who goes on which RFP, and maybe even a special committee gets set up for RFP ARPA monitoring, where the councilors can get together and not violate any quorum or have any quorum issues with meeting law, and kind of openly discuss, okay, well, here's where we are in this RFP, here's where I am in this one. And that, you know, and I can go to those meetings to help in any way I can, but that might be something to look for in the future if it's of interest to the council.
I think, as with all things in government, you know, transparency and communication is the key. And I think we're all on the same page in that regard. So are there any other questions for Tom before we bring today's meeting to a close? Seeing none, Tom, thanks so much for joining us. And Councilor, thank you for your attendance. And we will reconvene 2 weeks from today. And we'll make sure that notice goes out. Have a wonderful rest of your day.
All right, Councilor Letterman.
Thank you, Councilor.